that we should be sharing with our clients, our constituents, our friends and neighbors, because it really does affect everybody. We're also excited to have April Kruta from the Office of Minority Health and Equity, who's going to share some great information about the new statewide Health Equity Action Plan, also known as HEAP. And so thank you, Jack and April, for joining us. Before we jump into those presentations, I am excited to share that United Way's Day of Caring is right around the corner, and you can join us on Friday, September 22nd, 2023, for the largest volunteer event in Southern Nevada. This is our one-day community-wide volunteer initiative that brings together hundreds of volunteers with the nonprofits that need their help. If you're interested in volunteering or hosting a project, please visit the link in the chat box to the side. And so to get us started today, I'm going to welcome Jack Cheevers from CMS. He's from the Centers for Medicare and Medicaid Services, who is going to share about the No Surprises Act. And this new federal law protects consumers from receiving surprise medical bills when they get most emergency services, non-emergency services from out-of-network providers, and services from out-of-network air ambulance providers. I actually live close to Sunrise Hospital, and so I see those air ambulance providers on a regular basis. You can learn more about the No Surprises Act by visiting www.cms.gov/no surprises or call the No Surprises Help Desk at 1-800-985-3059. And so with that, I'm going to hand things over to Jack Cheevers from CMS. Thanks, Jack, for joining us.
Well, thank you, Aaron, and thank all you folks for taking the time to join us today. Again, my name is Jack Cheevers. I do public outreach campaigns for CMS. I'm attached to the San Francisco Regional Office, which we work with Nevada. That's one of the several states we work for. And I just wanted to walk you through this law. It's got a lot of important consumer protections. And it's just come into existence relatively recently. It was signed into law January 1st last year, and it's really the first comprehensive federal attempt to come to grips with the whole problem of surprise medical bills, which have been adding to people's medical debt and causing people a lot of financial problems for a long time. So let me start by just defining what a surprise bill is. It's when you get care from a doctor, a nurse, or somebody who's not in your insurance network, and they send their bill to your insurance company. Your insurance company turns around and pays only a portion of it, maybe 50 or 60% of it, and then the out-of-network provider in turn hits you with the balance of their bill. And balance bill, surprise bill are pretty much interchangeable terms. The surprise bills often arise in emergency situations. Let's say you're in a car crash or a bicycle crash or something, and you go to an ER. You might be, you're in pain, you might be bleeding, you might be unconscious, and the last thing you're going to do is go around the room and ask each of the doctors and nurses there, are you covered by my insurance? Are you covered by my insurance? People just are not going to do that. And the bills also can arise when you're getting non-emergency care at an in-network facility, such as an ambulatory surgical center, but one of the providers, it turns out, you find out later, is not covered by your insurance. So who does the law apply to? Who does it not apply to? It applies to you if you have employer group insurance, if you have an individually purchased insurance policy, let's say from Aetna or United Health, if you have Obamacare, of course, in Nevada, that's the Nevada Health Link, or if you're uninsured, or if you're what's known as a self-pay individual. These are people who do have insurance coverage, but for whatever personal reason they choose not to use it. Sometimes it's just cheaper to pay out of pocket than to pay a deductible. It does not apply to you if you're enrolled in Medicare, Medicaid, Indian Health Services coverage, VA healthcare, or TRICARE for life. all those federal health programs already contain protections against surprise bills. So let me start by, I wanted to show you our, I'm going to share my screen here and show you our web page. We just overhauled it, and can everybody see that? Okay.
Yes, we can, Jack.
Yeah. Okay. We just redid this whole thing, and it's a lot more consumer friendly. So this is the address for it up here, cms.gov/medical-bill-rights. I'll put that in the chat when I'm done talking. But this is a really good place to start. Look, if you have questions about the law, questions about a bill that you suspect might be a surprise bill, this is a really good place to get some basic information and help. Let me just take you to the help page right off the bat. Okay, you can see we have a 1-800 number down here, and that line is staffed every day. It's on weekdays you can call from between 8 a.m. and 8 p.m. Eastern, and on weekends it's staffed between 10 a.m. and 6 p.m. Eastern. We have translation services available in over 350 languages, including Spanish, French, Arabic, Russian, Nepali, and many, many others. We also have help in formats such as large print, Braille, or audio. And again, here's the phone number down here. It's all over the place, actually, this phone number. So let me show you some of these, some of the protections in the law. Okay, so let's say you do have insurance. So here are some of the rights you have. Okay, so the law protects you from unexpected out-of-network bills that you might incur during an emergency room visit, if you get non-emergency care at an in-network hospital, hospital outpatient department, or ambulatory surgical center, or if you get help from an air ambulance company. Okay, and this goes on to define what an emergency visit is. It's basically when you're in an emergency room at a hospital, if you're at a freestanding ER facility, or any department at a hospital where you might be getting post-stabilization services. So when you go to the emergency room, you're protected from unexpected out-of-network bills for emergency services in most cases. Okay, so assuming your insurance does cover emergency care, you can't be charged anymore for emergency services than the in-network cost sharing rate by either the hospital, any of the providers at the hospital, or an air ambulance provider. Okay, some plans don't cover emergency care. If you're unsure about it, you should call your insurance company. Okay, there's a little explanation what cost sharing is. Important note here, the law currently does not cover ground ambulance services. Don't ask me why, that's just the way Congress wrote the bill. So ground ambulance companies can still charge you out-of-network bills and cost sharing, unless they're prohibited under state law from doing that. Okay. So after you get emergency care, you might be given what's known as post-stabilization care. And you're also protected from out-of-network bills in post-stabilization services in most cases. We'll get to this notice and consent form in a second. Okay. There's a definition of post-stabilization services. You can get them in the emergency room or another department of the hospital. Let's say you're in a car crash, you hurt your head. The doctor wants to keep you overnight for observation. While you're admitted to the hospital as an inpatient, that would be you're going into the post-stabilization phase there. Okay, so let's talk a little bit about non-emergency room care that you plan in advance. I'm trying to get this thing up on the screen a little bit. Okay, so you might be seen by an out-of-network provider, even though you're getting care at an in-network facility. An example is your local hospital may be in your insurance network, but an attending a physician may not be in your network. Okay. You're protected from out-of-network charges when you get care at an in-network hospital, hospital outpatient department, or an ambulatory surgical center. And I had a personal experience with the ambulatory surgical center. I got I hope I'm not oversharing, but I got a colonoscopy last year. And before I went in, I called up the facility and I said, so is everybody on the surgical team in my insurance network? And I was assured, oh, yes, sir, absolutely. All the doctors and nurses are covered by your insurance. So I went in there, I got the procedure, I came home, everything was fine. A couple of weeks later, I get a bill for $1,400 from the anesthesiologist. So this doesn't seem right. I call up the facility. What happened? Well, the anesthesiologists, they bill separately, sir. Quote unquote, they bill separately. Well, that means they're out of network. So I said this, I knew a little bit about this law, obviously. And I said, this doesn't seem right to me. This seems like it might be a violation of the law. What can you do for me? And so the biller said, well, let me see what I can do for you. And she calls me back a couple of days later and she says, well, you'd be happy. Good news. I just got your balance reduced to zero. Well, that's great. How'd you do that? So the first thing she did was she sent the bill, the out-of-network, the anesthesiologist bill back to my insurance company as an in-network bill. And they paid it at in-network rates. And then because colonoscopy is considered preventive care under the Affordable Care Act, there's no copay for that, so the entire balance went down to zero. So this is some handy information to have. I mean, this can save you or your family or your friends some serious money if you wind up stuck with one of these surprise bills. Okay. And it's important to note that the protections don't apply to settings like your doctor's office if it's not in a hospital outpatient department, or if you go directly to an out-of-network facility. Okay. What are the exceptions to the law? Well, we mentioned ground ambulance earlier. The law also doesn't cover standalone vision and dental insurance plans. There's several other types of plans that are not widely used, such as short-term limited duration plans, healthcare sharing ministry plans, and several others here. Okay. So there's also something called the notice and consent form here. And where this comes into play is if you voluntarily, if you want to just go see somebody who's out of network, let's say it's a specialist, a cardiologist, or somebody you think is really great who's not in your network. Well, you can waive your protections under the law. The provider, the out-of-network provider, is supposed to give you this notice and consent form, and they'll ask you to sign it. If you do sign it, it means that you're agreeing to pay the out-of-network rate, which is almost invariably higher than in-network rates, and you're going to give up your protections under the No Surprises law, okay? If you don't sign the form, the provider of the facility may refuse to provide you non-emergency or post-stabilization care. You might have to reschedule care with a provider or facility that is in your plan's network in order to get the in-network rates, okay? So if you want to save money and stay in your network, don't sign the form, okay? You're likely to have to pay more if you go outside your plan network. What's on the form gives you an estimate of what the out-of-network care is going to cost. It gives you information about your protections under the law. Again, you have the option of waiving those protections if you sign the form. And if we're talking about post-stabilization care, you're supposed to get a list of in-network facility providers at that facility that can provide you with the care that you're seeking. Okay. All right. So if you do, if the provider does ask you to sign the form, they can do that in certain circumstances, such as if it's clear that you can travel to a nearby in-network provider without needing medical or emergency transportation, or if you're in a condition to give informed consent. Okay. All right, and these are some rules that the providers have to follow when they give you this form. It has to be separate from other documents. It can't be hidden within a big pile of paperwork somewhere. It has to be given to you in a way you prefer, either printed on paper or emailed. It has to be written in one of the 15 most common languages that are spoken in the state where you're getting the care. If you speak a different language, you have to have access to an interpreter. It has to be given to you in advance. Okay. If you think the provider didn't follow those rules, you can submit a complaint to us. Okay. All right. And you shouldn't get a notice and consent form in the emergency room, or if there is not an in-network provider that can provide the same non-emergency service at the in-network facility. Okay, and there's some more details about this form. Okay, so that's if you do have insurance. Let me back up and show you the protections for folks who don't have insurance or who are self-pay individuals. Feel free to stop me if anybody has any questions while we're going through this material. Okay. Okay, so if you don't have insurance or you choose not to use it, the provider has to give you what's known as a good faith estimate about how much the care is going to cost you. You get the estimate when you schedule the care at least 3 business days in advance, or if you ask for one, you may be able to dispute the bill if it's at least $400 or more higher than the initial estimate. Okay, you're not going to get an estimate during emergency care. Okay, so if you're not using insurance, let your provider know so that they can prepare the good faith estimate for you. Okay. All right, what is the estimate? It's just what it sounds like. It's a list of the expected costs for the care you're getting. It's not a bill. Okay. And you're eligible to get one if you schedule a care again at least 3 Monday through Friday before you get the care itself. Okay, if the provider doesn't give it to you, you could ask for it. Okay. Okay, again, there's an example of what might be honest if you're going into a hospital for surgery. You should ask for 2 estimates, one for the surgeon, one from the hospital. And the estimates would include things like the cost of the surgery, hospital fees. It could include all sorts of other charges for lab services, radiology, imaging services, all that sort of stuff, anything you're going to get during your surgery. Okay. All right, so get it in writing. And if you make sure you save it so you can compare it to the final bill. If you're
Did we lose Jack?
We may have lost Jack. I'm sure he might come back.
Okay. That is unfortunate, but thanks everybody for bearing with us. Let's give Jack a few moments to join. We do see a question from Jackie. How far back can you go to dispute a bill? If Jack isn't able to rejoin us, we will absolutely follow up.
Oh.
You just okay, if let's assume that Jack will be able to finish his presentation when he rejoins. April, are you ready to get started if we move over to your presentation? Wonderful. Well, thank you, Jack. Thank you to Jack Cheever for joining us from CMS today. We'll follow up. We'll ask Jack if he's able to rejoin to complete his presentation after this next one. But for our second presenter, I'm very proud to welcome April Kruta from the Office of Minority Health and Equity, who will be sharing more about the Statewide Health Equity Action Plan. And this new resource is meant to support entities throughout the state to implement health equity strategies and collecting data, building organizational capacity, community engagement, multi-sector partnerships, language access policy, and emergency preparedness. Thanks for joining us, April, and take it away.
Thank you, Aaron. That's unfortunate that we lost Jack there. Hopefully he can come back on and finish. I'll go ahead and share my screen and just let me know if that looks good on your end.
Looks
All
good.
righty.
You can see it.
Great. Let me just 1 second fix my screen here. All right, I'll go ahead and get started. Hello, everyone. Thank you for having me and for the opportunity to speak to you all today. My name is April Kruta. I'm the Program Officer for the Nevada Office of Minority Health and Equity. I'm excited to share with you all a new and exciting resource that has just been released from our office, the Statewide Health Equity Action Plan. And you're going to hear me refer to it throughout the presentation as the HEAP. So today we're going to do an overview of the HEAP, how and why it was created, give you some examples of content from the HEAP. I'll also share with you a link to the resource if you haven't received it already. And we got Jack back, I see.
Jack apparently had technical problems. I'm so sorry.
Hey, Jasmine, can I ask for some air traffic controlling here? What's the best way
Absolutely.
forward?
Hi, Jack. Thank you so much for coming back. I'm so sorry we lost you on there. I think at this point we'll go ahead and we'll move on to April, but I do want to acknowledge we did have one question for you in the chat from Jackie. And I'm sorry, Jackie, if I mispronounce your last name, but I'm going to say Rajin. How far back can you dispute a bill?
You can dispute it back to January 1st last year. That's when the law took effect.
Thank you, Jack. And Jackie, I hope that answers your question as well. If anybody else does have any questions in the meantime, please feel free to still drop them in the chat box. Jack, feel free to leave your information one more time in the chat box as well, and we'll ensure to connect you to everyone as well. So thank you so much. We appreciate you, Jack, for being here. And thank you so much, April, as well. So sorry to interrupt your presentation as well. But we'll go ahead and continue on with you, April. Thank you so much. Thanks, Aaron.
Thanks, Jasmine.
Thank you, Jack. That was such amazing information, very helpful. So I would like that website as well that you were navigating through. If you could drop that in the chat.
I'll put that in the chat, April.
Thank you. All righty. So just to continue, so you all know what to expect from my presentation today, I'm going to introduce our office, the Office of Minority Health and Equity, do an overview of the HEAP and the methodology, dive into some of the content, and then wrap up there. So a little bit about our office for those of you who don't know us. We are the Office of Minority Health and Equity, also known as NOMI. We like to use our acronyms. We're a state agency housed within the Director's Office of the Department of Health and Human Services. Our focus is on all intersecting populations, including racial, ethnic minorities, sexual orientation, gender minorities, elder populations, those of varying immigrant status, those across the full spectrum of ability status, and rural and tribal populations. So our mission and vision is to reduce or reverse disproportionately experienced health disparities among the state's most vulnerable and high-risk populations. And some of the ways we do this is through embedding health equity principles into operations of state agencies and organizations. We implement initiatives to improve the quality of healthcare and information dissemination. We create and amplify educational materials, conduct some trainings on cultural competency, disparities, et cetera. And we also inform policies that could affect the health of minority populations. There's also a QR code here to our website on the slide there. So going into the HEAP, first of all, let's talk about why health equity is important, right? So in reviewing national, state, and local health data, it's evident that there are stark differences in health outcomes showing negative impacts on some of the populations that have been historically marginalized. So policies and systems were built, some unintentionally, some intentionally, that actually harm and leave some communities in worse shape than others. So that's why it's important for us now to advocate and empower our minority and underserved communities in order to achieve optimal levels of health for all. So a quick overview of the plan. The purpose, the goal of the plan is to serve as a resource to support organizations throughout the state to promote and support health equity in their work by providing recommendations for policy, program, and resources that can be applied to current and future practice. So the audience then is any organization of public service who work in any of the social determinants of health, who interact regularly with community members. So including but not limited to nonprofit and community-based organizations, state agencies, private and public health systems, local health departments, and more. And so how to use it is it contains actionable recommendations, resources, and case studies for the reader to use and reference. And I'm going to go over the contents with a little more detail in the next few slides. Just wanted to go over the steps in creating the plan. So the steps were collecting data, analyzing the data, interpreting the findings, and then developing the plan through the findings. So for collection of data, we reviewed health equity and public health literature from sources like CDC, Robert Wood Johnson Foundation, GARE. And then we took a look at health disparities that exist in Nevada specifically. So things like dashboards, reports, and things like that. And then primary data was collected through a series of interviews with subject matter experts and key informants in Nevada, who also gave insight on how we can improve health equity in our state. So the recommendations that we see in the plan are a result of combination of the literature review as well as from key informants. So then data analysis was done through qualitative and quantitative approaches, which then yielded 6 key focus areas in which we can prioritize our effort to action health equity in Nevada. So data, how we can use data as a tool for health equity work, building organizational capacity. So this contains recommendations for how to improve our workplace and team capacity to promote health equity. Community engagement and partnerships, so ways to improve our relationships with communities as well as with our cross-sector partners. And then language access, so improving language access services throughout the state. Policy change and advocacy, so advocating for that upstream and systems change. And then emergency preparedness, so this talks about being prepared for emergencies in a way that actively involves community and diverse partners. So here's just a quick snapshot of the table of contents in the plan. There's also a QR code that you can scan so you can have direct access to the HEAP. In the next few slides, we're going to dive into the meat and bones of the HEAP, the primary focus areas that I mentioned earlier, outlined in red here, and explore just a few of the recommendations, not all of them, because there's a ton. So just to recap, each focus area contains recommendations, resources, and case studies to provide an example of how each focus area has been actioned. And then it contains rural and tribal considerations where they're applicable. So the first focus area is data. So the literature shows that data can be used as a useful tool in health equity work, particularly in identifying inequities and developing targeted interventions to specific communities. Data is also an effective way to measure our progress and effectiveness in our health equity efforts. So this chapter in the HEAP offers recommendations for data collection and dissemination to advance health equity. So these are just a few of the recommendations. As a quick note, not all of the recommendations in all of the sections are going to be included in today's presentation just for the sake of time, but I have highlighted some of the main recommendations. So 1, using secondary data that already exists, right, to identify inequities and determine where to target department or program efforts, and also map out communities that need the most support. So the HEAP identifies several resources nationally, state and local data sets. It has indexes and maps and reports. And I dropped just one of them here because I wanted to highlight that Nevada has our own biennial report called the Minority Health Report, which NOMI collaborates with the Office of Analytics to produce. And the 2023 version has just been released and it is linked here. And then number 2, collecting primary data, our own data, right? So the HEAP suggests a few ways that we can do this to identify disparities and needs in the communities which we serve. It also emphasizes the approach to data collection called community-based participatory research, or CBPR. And all that really means is when researchers and organizations and community members collaborate on all aspects and phases of a research project. It utilizes community voice, community narrative, to help inform projects. I've linked the CBPR toolkit here. This was produced by the Nevada Minority Health and Equity Coalition, but this is a NOMI commissioned resource and it takes you step by step in that process. And then number 4 is about dissemination. We want to share our findings, right? So ensuring that data can be easily understood by folks by using things like dashboards, 1 to 2 page reports, infographics, and making sure that language is simple and easily understood and translated into different languages if and when possible. Okay, the next chapter is building organizational capacity, which essentially means to strengthen an organization's skills, abilities, and processes and resources that are needed to advance health equity. So findings indicate that in order to initiate a shift towards health equity, leaders and teams should demonstrate a strong commitment to integrating health equity into all aspects of the organization, right? From hiring to training and organizational practices, as well as within all levels of personnel, from staff, leadership to board members. So the HEAP discusses health equity considerations in these three areas: hiring, training, and organizational practice. It contains a lot of resources in there for trainings, as well as toolkits for building and creating an inclusive workplace internally, as well as an external service delivery. So let's dive into just a few ways to build capacity. So hiring practices, we want to cultivate a workforce that's representative of the population that we serve, right? Through recruitment and retention. The HEAP offers examples of how we can recruit and maintain a work environment that uplifts diverse communities and diverse voices. And then training, building staff capacity through trainings, right? Incentivizing and ensuring that training topics are also being applied in practice. So there are plenty of trainings and education out there on topics like diversity, equity, inclusion, cultural sensitivity. I dropped a few examples from the HEAP here of free trainings that you can find online on topics like health equity and some of the other topics I mentioned. And then organizational practice, this offers ways that an organization can continue to practice principles of health equity through inclusion of diverse voices in decision-making, developing a DEI guiding statement and action plan, utilizing guides and toolkits for how to do this. And there are examples here of tools that can be used to guide practices in the workplace. So as a note throughout the plan, I typically give a recommendation, and if there's a resource or tool out there that I found that can help you conceptualize it and implement it with more clear action steps, I drop it here, as you can see. All right, now community engagement and partnerships. So this refers to working with communities to address issues that affect their well-being. It aims to uplift community voices in order to help us with our efforts to address health inequities. Also partner engagement, right? It helps to have partners across different sectors to help address priorities across the social determinants of health. So in this section, the HEAP offers considerations for developing relationships with communities and partners that are inclusive, collaborative, and long-term. It also includes a few considerations for engaging with rural and tribal communities. So let's take a look at some of those considerations. So number 1 and 2 emphasizes genuine and long-term engagement. Communities like to know that you, your organization, and your services are going to be around for long-term, right? Not just for the duration of a project or a survey. And then number 3 says involving community and decision-making. So this entails learning more about them and their experiences first, such as the context and the assets about the community, asking questions about what is important to them without deciding on our own what's best for that particular community. Number 4, going where the community gathers. So as an example, NOMI works with the Southern Nevada Health District to host barbershop talks, where we bring forth health topics to barbershops and talk to the community about important health matters like cardiovascular health, mental health, et cetera. And we bring out professionals, doctors. We've also brought out athletes from the Raiders before that are representative of the community, of course, to talk to them about these issues and offer resources to help. And then partner engagement, let's jump there. How can we better leverage our relationships with other sectors, right? So this really goes over sharing resources, joining coalitions that work to promote health equity, such as the Nevada Minority Health and Equity Coalition, supporting local events by NGOs and CBOs, staying up to date on resources and organizations that are doing great work in the community, by keeping that relationship with them through information and resource sharing, collaborating on initiatives, et cetera. All right, now language access. We know that this is essential in ensuring equal access to services and information, such as health information, emergency information, warnings and alerts. Language also takes into account the use of plain and culturally appropriate terms and language, right? And disseminating materials in accessible places and formats. So in this section of the HEAP, it offers resources and recommendations for increasing language accessibility, as well as culturally appropriate messaging and materials. So a very quick overview about ways we can do this. So number one, the HEAP offers ways to provide accessible services to folks who may not speak English as their first language, and more on this can be found in the HEAP. Number two emphasizes using plain and culturally sensitive language, specifically fourth and fifth grade reading level, so that messaging is easily understandable. It also references the National Culturally and Linguistically Appropriate Standards, the CLAS standards. And this was developed by the Federal Office of Minority Health. And this really just guides us through ways that we can do this. And then number 3, 4, and 5 talks again about possibly involving community in the development of some of our language and campaigns. They can give feedback on the effectiveness of our messaging. They can also offer ideas on the best way we can disseminate information so that it reaches diverse and minority communities effectively. All right, and policy change and advocacy. So what typically leads to some of the most impactful change in outcomes? It's policy and systems change, right? It is critical to health equity. So advocating for policy change, it may include influencing contexts where decisions are being made. So the HEAP here discusses ways to inform and promote policies and practices that advance health equity, both internally, such as within our own respective organizations, as well as externally, such as public policy. So number 1 refers to internal and organizational policies and how we can influence them to promote health and racial equity in our workplace practices. Number 2 talks about how we can influence public policy, legislation to promote health equity and address health disparities. Some of the ways this can be done is through health impact notes and health in all policies, which is essentially an approach to improving the health of all people by incorporating health considerations, health notes, into decision-making across sectors and policy areas. So it essentially takes a policy or program and does an analysis and presents data on how it can really impact the health of our communities. And last but not least, we have emergency preparedness. So this refers to prioritizing health equity and emergency response to make sure that efforts are tailored to meet the unique needs of all populations. So the HEAP here offers ideas to cultivate multi-sectoral partnerships in order to increase capacities for equitable emergency response. It also talks about increasing community engagement and increasing community capacity for preparedness. All right, so just a few recommendations for preparedness using lessons that we learned right through the COVID-19 pandemic. So number 1 refers to including partners who are directly working with and inside communities to help with coordination mechanisms, such as helping spread emergency alerts and warnings, and helping to offer strategies and solutions for reaching community members effectively. Number 2 refers to putting together action plans that thoroughly consider the gaps that were identified in the COVID-19 pandemic, including considerations for those with disabilities, the elderly, utilizing community health workers, and possibly partnering with college and universities to have students aid with an emergency response. And then number 3 talks about empowering and educating community members to prepare and respond to emergencies or hazards within their own communities and neighborhoods. And there are currently programs that exist, such as the CERT programs, which essentially trains community members in basic preparedness. And the last thing I'm just going to review, it's quick, it's really important. I think that it could be useful in navigating the HEAP. So the appendix, this includes a table of all of the resources and links that are referenced throughout the HEAP. So as you can hear, here are some screenshots of the headers below. So it contains data sets, reports, and indexes, trainings and courses, tools, toolkits, and guides, and then miscellaneous resources. So in the table, you'll see the title, the author, the link to the resource, the HEAP areas that are covered in this resource, and then the pages on which it's referenced throughout the HEAP. So I know that the HEAP is a very long document, so hopefully this table is a helpful tool to help you navigate the resources and the content. Alrighty, that's all I had, but I know it was a lot of information, so thank you for sticking with me throughout the presentation. I hope that this overview was helpful and that you feel that the HEAP could be useful to you in your work. If you have any questions or want to reach out to me directly, my info is on the slide. I'm happy to take any questions. Oh, and there is the QR code to the HEAP one more time.
Thank you so much,
Thank
April.
you.
That was an excellent presentation. And I have to say, everybody on the call, if you haven't taken a look at the HEAP yet, please do. It is full of so many action-oriented recommendations. Many times reports and documents, it takes a long time to get to the meat and bones. I think April used those terms. The whole thing, the whole document is chock full of great recommendations that we can start integrating into our work on a day-to-day basis right away. So thank you, April.
Thank you.
Who has a question any questions for April, you can pop it out now, or you can use the raise hand function found in your reactions option at the bottom of your screen. Any questions? Okay, if you have any questions for April, she did share her contact info. April, if you could pop your email in the chat as well, so folks can follow up with you directly if they do have some additional questions. We'll move back for a moment to Jack Cheevers. Jack, thanks so much for rejoining the meeting. We wanted to give you an opportunity to share any additional key points that may have been cut off, and we wanted to give folks a chance to ask any additional questions. So thanks again for rejoining.
Thank you, Aaron. My apologies again for dropping off there. My colleague Christina tells me that I was close to the end of the presentation anyway, so I think I pushed out most of the info. But just put the web address in the chat if anybody wants to take a look at it. Yeah, and I'm happy to answer any questions. And folks, if something comes up tomorrow or next week, you had a question about, feel free to email me too. I put my email address in there.
Thanks again, Jack. We know that there are many households and families that either delay or forego medical care because they either don't know how expensive that care is going to be, or they do know, and that's why they're foregoing it. So some of those key pieces of key things like the good faith estimate and some of the other items that you shared, very, very valuable, very important for us to equip our community members with this knowledge so that they can advocate for themselves, and to equip our nonprofit sector so that we can, in some cases, advocate on behalf of the clients that we're serving. Thanks again for joining us, to you, Jack, and Christina as well. Thank you so much.
Thank you.
Okay, now with that, thanks again, April and Jack, for those excellent presentations. And a reminder, everybody, there are a lot of great links and contact information in the chat box. It is now time for our community updates. And so we'll be, as I go through these updates, we'll be placing all the details, links, and flyers in the comment box. Please continue to send us any resources, programs, or updates to the email address npc@uwsn.org to share with our network. We'll definitely get it into the flow for these monthly meetings. As a friendly reminder, we will have a short open forum after these community updates for any organization or community member that would like to share about their resources, programs, or upcoming events. So with that, let's get started. There is a community resource fair being put on by Archwell Health, which is a senior primary care provider. You can join to participate in Archwell's Community Resource Fair on Thursday, July 20th, 2023, from 10 a.m. to 12 p.m. And that's at 921 West Owens, Las Vegas, Nevada, 89106. This Community Resource Fair is open to all ages, and you can discover resources for medical insurance, housing, food, utility support, and more. There will be over a dozen vendors, including Clark County Social Services, Aetna, Humana, United Healthcare, Nevada HealthLink, the Just One Project, Helping Hands of Vegas Valley, and more. The link has been put into the chat, There is no registration required, and if you'd like more information, you can click that link that Jasmine just put into the chat. Is there anybody from Archwell Health on the call that would like to share more? With that, we'll move on to our next update. Novum Health next week, or in 2 weeks, we'll be celebrating the grand opening of the Novum Women's Center. And this is a health home for women and children. This is the grand opening on Tuesday, July 18th from 1 p.m. to 5 p.m. And the address is 3321 North Buffalo Drive. That's Las Vegas, Nevada, 89129. The Novum Women's Health Center is holding their grand opening and open house event, and it is open to all ages, the whole family. They'll have activities for everybody. And for more information, you can visit their website at www.novumwomencenter.com. And thank you again, Janet, for putting that link in the chat. Is there anybody from Novum Health that would like to share any more about the Novum Women's Health Center? Great. Okay, our next set of updates are save the dates. Clark County Commissioner William McCurdy has 2 upcoming back to school events. One on July 25th from 4 p.m. to 7 p.m. at the Walnut Recreation Community Center. And the second will be on July 27th from 4 p.m. to 7 p.m. at the Pearson Community Center. Join Commissioner McCurdy and the community for a backpack giveaway, free school supplies, resources, and more. Additional community support for both events is still accepted and welcomed. Vendors will have the opportunity to meet directly with youth and their parents. And the commissioner and his team expect over 1,500 students and families to participate in these events. And so if you are interested in being a vendor at these events, and you're able to provide school supplies or other materials for at least 500 students, please complete the form that Jasmine has shared in the chat. Just a reminder, they're expecting over 1,500 families. And if you'd like to be a vendor, you have to commit to providing school supplies or other materials for at least 500 of those students and families. Is there anybody from Commissioner McCurdy's office or this initiative on the call who would love to share about the back to school events? Okay, our next update is information on registering for the Diversity and Inclusion Liaisons July 19th annual meeting. And this is being put on by the Governor's Office for New Americans. And everybody is invited to the 2nd annual Diversity and Inclusion Liaison meeting, which will take place Wednesday, July 19th at 2 p.m. via Microsoft Teams. And this is being hosted by the Governor's Office for New Americans, specifically the Minority Interagency Collaborative. Oh, the Minority Interagency Collaborative is comprised of the Governor's Office of New Americans, the Nevada Office of Minority Health and Equity, and the Nevada Commission on Minority Affairs. This year's theme is collaboration across communities and is focused on how state agencies can be even more accessible to our minority communities throughout Nevada. If you're interested in sharing your thoughts and opinions on how the state can improve service delivery, please click the link that Jasmine shared in the chat. That's the link you use to register for the meeting. Is anybody here from the Minority Interagency Collaborative that can share a little bit more about the Diversity and Inclusion Liaisons meeting?
That does include my office, Erin. Some of my colleagues are taking charge of that event, but if you are free, it is open for anyone interested in DEI work. So.
Wonderful. Thank you so much, April. And last but not least, I'd like to welcome our very own marketing manager, Aubrey Kersey, who will share more about our UWSN Nonprofit Connection LinkedIn group. Aubrey, take it away.
Thank you, Erin. Hello, everyone. I just wanted to pop on today's call to give a little tutorial on how to join our LinkedIn group if you haven't joined it yet. So I believe my colleague Jasmine is going to share screen so that we can walk through. So it's super easy. I put the LinkedIn group link in the chat, so it's really easy to get there. All you got to do is click the join button, as Jasmine will demonstrate right here. And then let me go in real quick. Yes. Approve. Perfect. So you should be approved, Jasmine, to get in there. Perfect. And then it's super easy, so you'll be able to share any posts that you want, any updates. We wanted to give everyone another forum to be able to share updates in between meetings since they are monthly now. Really just any updates that you have, any resources you want to share, opportunities for collaborations, any discussions you want to have or connections you want to build, this is your forum to do so. We wanted to provide an alternative option on our social media, so it's easy for all of you to build connections and collaborate with one another. Also, just as a note, please keep it respectful in the comments. Our team will be monitoring, but as in this space, keep it respectful, keep it collaborative, and just overall positive energy. We appreciate it, and I look forward to everyone joining LinkedIn group and creating another space for collaboration. We'll also be posting our recordings there as well for easy access if you don't look at the follow-up emails or don't have access to them, just another easy way for you to access the recordings of these calls. So let me know if you have any questions. We look forward to collaborating with you.
Thank you so much, Aubrey. That is a group I will be joining momentarily. So thank you so much for sharing that link. Our colleague Janet Quintero also shared that the CEO Exchange has another nonprofit hiring event coming up on Saturday, July 19th. And there's a link to the Work for Purpose page in the chat as well. We have just a few moments for open forum. So if there are any community members or organizations that have updates to share, please use the raise hand function and we'll get to a few updates before we close out for today. Stephen, you get to go first.
Thank you. I just wanted to share that Leaders in Training is currently recruiting new members for the next academic year for 9th and 10th grade students. We operate in a cohort fashion, so new members would be new high school students. I'll share the flyer and the details in the chat box. We are a leadership development / college access / community service program that supports students to kind of engage in these things and have equitable opportunities to pursue these opportunities and prepare for post-secondary ventures after high school.
Thank you so much, Stephen. We love LIT and highly recommend anybody who thinks their student, their child might be a good fit, check out Leaders in Training. It's a great organization, great program. Thanks, Stephen. Paul Thornton from Nevada 211, over to you.
Just like to remind everyone that if you have not, we have a great meeting. We have a Nevada 211 Ambassador Alliance Group meeting every quarter, and it's held at our favorite place at the United Way of Southern Nevada, here and in Northern Nevada too. And we have 168 ambassadors. We have generally about 60 people that attend. It's next Tuesday from 10 to 11 a.m. And it starts on time, ends on time. I'll be there in person, but a lot of people be there on Zoom. And we cover, like I said, the whole state of Nevada, rural areas and things like that. Lots of great people there. If you want to get the invitation, my information is in the inbox or chat box, I'm sorry, and I love to do. And also, when we have the meetings there on a quarterly basis, we always have two speakers and they are honored. We also have a Nevada 211 monthly newsletter that honors our agencies. That goes out to 14,000 emails and also on our social media pages at this time. So if you're part of 211, we can honor you. I am looking for some agencies that would like to be honored after September. So I would like to thank you all about that. And one other thing, quick thing, Erin, a suggestion maybe. I noticed that two of my agencies, or one of the agencies with two people, are new on here today, and that's Mary Ralph and Kieran McManus with the emergency aid of Boulder City and whatever. Maybe that's something that, we try to honor something, whatever is recognized when new agents come on, because we want them to come back to and listen to our events and everything. So just a suggestion, but I'd like to recognize them. They do a great job down there in Boulder City and gets lots of referrals for the people they help. So thank you all. Thank you, Aaron.
Thank you so much, Paul, and thank you for recognizing Mary and Kiernan from Emergency Aid of Boulder City. It's a great organization. We agree. We love working with them. Thank you, Paul. We'll look forward to seeing the 211 crew at United Way's offices on Tuesday. Wonderful. Jenny, well, Paul had a great comment about ending on time. So we're a little bit past 3 o'clock, but we're going to try and finish up soon. So Jenny, we're going to give you the last update of the day. Take it away.
Thanks. I just wanted to give an update for people who utilize family resource centers in the Valley, that Olive Crest is now, yes, continuing to be North and Northwest Family Resource Center, but the state just recently asked us starting Saturday to take on all of the West zip codes as well. So if you work with folks who are in the West and maybe you weren't sure where to direct them if they needed some of those tangible resources, just have them call Olive Crest or reach out to Olive Crest. I know back to school is coming up. We've got supplies for that. Just any of those needs, we want to make sure people know you can reach out to us. We're happy to help.
Thank you for that critical update, and thank you for agreeing to take on those additional parts of our community. Thank you, Olive Crest. Thank you, Jenny. With that, if you do have any other open forum updates, please add them to the chat box. We'll keep it a little bit open for a few minutes after we close the meeting. If you would like to present or share updates at our next meeting, you can email npc@uwsn.org. And if you have questions, you can email us at info@uwsn.org. If you have questions, volunteer interest, or if you'd like to sign up for our contact list, you can visit us at www.uwsn.org/NPC. We'll put all those links in the chat box. And at this stage, I'd just like to thank everybody for joining. And another big thank you to Jack Cheevers from the Center for Medicare and Medicaid Services, as well as to April Kruta from the Nevada Office of Minority Health and Equity. Thank you, everybody, for joining, and have a wonderful, wonderful July. We'll see you next month.
Thank you. Huge shout out to you, Aaron. Thank you so much.